Hello friends, so today we will learn a few important questions from the human health and diseases chapter of biology. So let us start. Question number 1. To which type of barrier under innate immunity do saliva in the mouth and tears from the eyes belong? So as we know that there are different types of barriers like physiological, cytokine, cellular barrier, physical barriers. So saliva and tears comes under the physiological barrier. Option number A is right one. Next, an insect bite may result in inflammation of that spot. This is triggered by the alarm chemicals such as it is histamines and kinins. So whenever insect bites, it leads to the release of histamine and kinins, which causes the swelling and inflammation or redness of that particular point. Next question is antigen binding site in an antibody is found between. So it is found between the one heavy and one light chain. Option number C. The antigen binding site, that is Fab region, is found by the variable region of one heavy chain and one light chain of any antibody. Next, a person preparing food like Mary Milton can be major source of spread of the disease. So it is typhoid, which can be spread through the contaminated food or water, and a carrier like Mary Milton can transfer the disease to others. Next question, hepatitis B is also known as, serum jaundice. Hepatitis B is a viral infection that is transmitted via blood or other bodily fluids, and it is commonly referred to as serum jaundice due to its association with the liver damage. Next, the letter T in T lymphocyte refers to, it refers to the thymus. Option number B. T lymphocyte, they mature in the thymus, which is a primary lymphoid organ of the immune system, hence named T lymphocytes. Next, what is correct? So option number A, that is malignant tumors may exhibit metastasis. So malignant tumor can invade surrounding tissue and the spread to other parts of the body through bloodstream or lymphatic system is known as metastasis. Next question, pair of viral diseases. So it is option number D, that is common cold and AIDS. These are both viral diseases. In rest option, there are some bacterial diseases, some fungal diseases, and maybe protozoan diseases. A person likely to develop tetanus is immunized by giving, he is immunized by giving the pre-formed antibodies. Option number B. In case of tetanus exposure, immediate protection is provided by injecting the tetanus antitoxin, which means pre-formed antibodies to neutralize the toxin already produced by the Clostridium tetani. Use of antihistamines and steroids gives a quick relief from, these are used against allergic reactions. Option number C, that is allergy. Rejection of organ transplant is due to, these are due to cytotoxic T cells. Option number C. Next question, most commonly used marker enzyme in clinical diagnosis of prostate cancer is, it is option number D, acid phosphatase. Acid phosphatase, especially the prostate specified acid phosphatase, is commonly elevated in the prostate cancer and is used as a diagnostic marker. Vidal test is used for the diagnosis of, the typhoid, which is caused by a bacteria called Salmonella typhi and spread through the contaminated food and water. Which of the following techniques is safest for the detection of cancer? So it is MRI, that is magnetic resource imaging. It is considered as the most safe for the detection of cancer because it uses non-ionizing radiation to produce detailed images of the tissues, making it safer as compared to the radiography or CT scans, which uses ionizing radiation, which are more stronger and harmful. Next one, which one of the following cannot be used for preparation of vaccination against the plague? So it is option number C, that is virulent live bacteria. So a live bacteria cannot be used for preparation of vaccine because it can cause the disease. Next question, which is quite important, ringworm in human is caused by, it is caused by the fungi like Trichophyton, Microsporum, Epidermophyton species, which generally attack the skin, hair and nails. These causes ringworm in human beings. Next question is, in the immune system, interferon are part of, interferon, as we know that these are produced against the viral attack So these act as cytokine barrier. Option number D. Interferon are signaling proteins produced by virus infected cells. They help in activating the immune cells and preventing the spread of the viral infections. A person suspected to suffer from AIDS, acquired immunodeficiency syndrome, is advised to undergo diagnostic test. So ELISA test is used for the diagnosis of AIDS. It is caused by a virus called HIV, human immunodeficiency virus, and the test used is ELISA, enzyme linked immunosorbent assay. It is used to detect the antibody against the HIV virus. Next question, at which stage of HIV infection does the patient show symptoms of the AIDS? So it is option number A. Whenever there is reduction in the T lymphocyte, it is a symptom of infection of HIV. So option number A is the correct one. Next question is, which one acts as a physiological barrier to entry of the microorganism in the human body? So it is tears. Option number D. The tears contain enzyme called lysozymes which destroy the bacterial cell walls, acting as a physiological barrier. Interferons are, so it is option number D. These are the proteins secreted by the virus infected cells which protect non-infected cell from further viral infections. Next one, which one is obtained by acetylation of the morphine? So option number A, that is smack or heroin. It is an opioid derived from the morphine through acetylation process. Next is cocaine interferes with the transportation of the neurotransmitter dopamine. Option number B. So dopamine is the answer. Cocaine blocks the reuptake of dopamine in the brain, leading to increased level in the synaptic cleft and heightened stimulation. A factor responsible for cirrhosis of liver. It is very important question which has been already asked in many exams. So it is alcohol, which is mainly responsible for the cirrhosis of the liver. Option number C. Anxiety and eating spicy food in normal humans may lead to, so it may lead to indigestion. Option number A. Motile zygote of Plasmodium occurs in the gut of female Anopheles. Option number C. Common cold differ from pneumonia in that pneumonia infects the alveoli, while common cold affect only the nose and respiratory passage, but it do not affect the lungs. Ringworm infection is caused by, so it is caused by a fungus called trichophyton. Option number B. Antiserum has antibodies. Infection of Ascaris occurs due to, so they occurs due to the contaminated food and water. Option number D. Cell-mediated immunity inside the human body is carried out by the T lymphocyte. Option number B. Sexual stage of Plasmodium occurs inside the intestine of the mosquito. Option number C. Immunoglobulin abundant in the colostrum, which is also called first milk. So it is IgA. Option number B. It is a predominant immunoglobulin in the colostrum, providing the passive immunity to the newborn by protecting the mucosal surface of the digestive and respiratory tracts.